According to the president of the Oklahoma Hospital Association, in the last 5 years, 6 rural hospitals have shut down and 8 more have declared bankruptcy. This week, we're going to take an in-depth look at why our rural hospitals are struggling, how's been made worse by the pandemic, and what's being done to fix the problems if they can be fixed. Steve Shaw begins our report in the small town of Prague in southeastern Lincoln County.
The only things Cliff Bryant loves more than OU football are his family and the town of Prague, which is a unique community of around 1,800. It's a place he's called home pretty much since kindergarten. Cliff's also been mayor here for 7 years. For more than half that time, Prague's beloved 15-bed community hospital financially's been on life support.
The path has been rough. The previous owner, 2 previous owners ago, owned multiple hospitals and went bankrupt on all of them. And then they went to bankruptcy court in North Carolina, and several offers were in the mix, but the nonprofit out of Tulsa purchased the hospital last year and gave it a good shot for almost a year.
But last Wednesday, the Tulsa nonprofit that purchased Prague in bankruptcy court less than a year ago turned the hospital back over to the city. Mayor Cliff says the nonprofit was already in the hole more than $1 million.
They were aware of that. They were aware that they were struggling, and some of the vendors were aware.
Patty Davis is president of the Oklahoma Hospital Association. They represent 119 hospitals around the state. She says rural facilities started getting pinched a decade ago with the passage of the Affordable Care Act. It allowed more people to be covered, but also meant hospitals agreed to take less in Medicare reimbursements.
The agreement was for the cuts that all hospitals would experience under Medicare, which is a program for people over 65, then states would choose to expand Medicaid and start covering more of the uninsured. And in Oklahoma, did not do that. And Oklahoma has a dubious distinction of being the second highest, only behind Texas, in the number of uninsured.
Davis says rural hospitals have been especially hard hit because their patients, on average, are older, sicker, and in most cases have less financial means. Also, she says far fewer employers in small towns pick up the tab for employee health care.
First and foremost, there is a myth out there that if you are poor, you qualify for Medicaid, and that simply is not the case. In Oklahoma, you have to be eligible by category, meaning you have to be a pregnant woman, a poor child, someone that is disabled, or someone that's elderly with very low income. So if you are a low income husband and wife, and you work for low wages for an employer that does not furnish insurance, you do not qualify for Medicaid.
Then last June, Oklahoma voters, by the thinnest of margins, approved State Question 802, which expands Medicaid eligibility for adults between the ages of 18 and 65. It takes effect this July.
We've got to work through the funding of that. The legislature will have to work through that in the next session, because it's important to note that doing Medicaid expansion, for every $1 that the state appropriates, we're going to be bringing back $9 federal to match. And this is the economic shot in the arm that our hospitals and our healthcare systems need right now.
How many hospitals have you saved, would you say, in the last 5 or 6 years?
Total hospitals saved at least 10.
Godwin Fay is president of Shawnee-based Cohesive Healthcare. They specialize in saving rural hospitals, and they've been trying to save Prague. Mayor Cliff says Cohesive's been a godsend.
These hospitals are very important to stay open in these small communities because, as we are all aware, in the rural areas, people kind of live sparsely. Someone might live maybe 10 miles from the local hospital. And if you compare, if the hospital wasn't there, they're probably going to be maybe 50, 60 miles to the nearest hospital.
Fay says expanding Medicaid will provide a boost.
Every little bit helps. The Medicare expansion, I think, was a big win. for not just the rural hospitals, but for every health institution. But my encouragement to every local community that is struggling with their hospital is do not wait till it's too late to ask for help.
Rural hospitals are about to get more help. Last month, Congress passed and the president signed $900 billion in new COVID-19 relief legislation. Mark Woodring is Assistant Dean for Rural Health at OSU.
There's a part of that bill that will create a new rural hospital designation called the Rural Emergency Hospital Designation by 2023. It will allow rural hospitals to transform, and they can shift their focus onto more outpatient care, emergency care, participating in telemedicine, while discontinuing maybe inpatient care where they might not have the volumes or financial infrastructure to continue supporting inpatient programs and working with other regional providers. So that new rural hospital designation should help many rural Oklahoma hospitals.
Woodring says broadband expansion and a stronger rural infrastructure will be key.
Reimbursement has certainly played a big part over the past few months in terms of seeing more providers and hospitals participating in telemedicine. So as we move forward, I think the reimbursement policies related to telemedicine and telehealth will be very important as we continue to look at that.
Woodring says there's no cookie cutter approach here.
What we found is that rural hospital closure does impact rural Oklahomans different from other places across the country. The next nearest hospital is often more than 25 miles. 85% of hospital closures across the country, there's another hospital within 25 miles. Of that group of hospitals, the average distance is only just over 14 miles.
Before Christmas, we were maxed out at capacity. You couldn't get a room. It was 100%. As soon as the bed came open, it was filled.
Prague Community Hospital cared for Mayor Cliff Bryant's parents just before they died, 14 hours apart on December 21st. Shirley from the COVID, Cliff Sr. from other serious issues, and a broken heart.
It's personal for everyone.
Steve Shaw, the Oklahoma News Report.